record. Good evening, everybody. Please welcome to the 39th webinar, which we've been doing it all through with time and continuing it. 39th NJH webinar. And today is very, very exciting because we have here Dr. Lata, a very, very close friend of mine and one of the very experienced NJH team members. They're together from the ICRO MLDT airport, and she's from Bangalore. So Dr. Lata is going to talk to you. Remember last time, actually we're supposed to both do it together, but we have wanted, it's such a big topic that we split it up. And I did adjustment disorders because that is our main problem as of today. In today's times, women's adjustment has become a big issue, right? So we split it up, and today she's doing the second most important topic, which is all-encompassive because all the problems will have some bleeding disorders, menorrhagia as she calls it. So she's going to share all her cases with you, and we are going to learn a lot. So yeah, so keep coming to NJH, keep enjoying, keep learning, and keep sharing what you learn, what you experience, how it helped you. Okay, so today now, I'm not going to talk more. I'll hand over the mic to Dr. Lata.
Good evening, ma'am. Thank you, ma'am, for coming and sharing the introduction. And really, both of us were supposed to do this together, but we learned so much from you last time. So that was a very important part of interpersonal relationships and management, which plays a key role in our health, especially as females. And today we'll go to the causes of menorrhagia and take up as many causes with a case study, and probably conceptualize from those cases what we learned and how we can apply it in many other such cases of those conditions. Sure. Want to thank ma'am. Thank you for all the opportunities that you create for us every time to learn, share over the last so many years. You've given us the confidence to present our story, our success as well as our failures. And thanks to Asrani sir, Bhaskar sir, Praveen sir, Ajit sir, and all the other sirs and my team at NJH, who have always ensured that they're so passionate about the system that it's just very infectious. We keep getting drawn into it. Thank you. Yeah. So what is menorrhagia? Learned it from Sir, Asrani sir. Am I audible, ma'am? I'm
yes,
just recovering from a little throat.
No problem.
It's an abnormal heavy bleeding at the time of menstruation. So we are not talking about the intermenstrual bleedings or frequent menstruations. We are talking about those conditions where the bleeding is going to be the maximum at the time of menstruation. And how do we know we have excess bleeding? 6 or more pads per day or 3 big pads, 30 ml collection in a cup. And we change the pads every 2 hours, even at night. And there is unusually more clotting.
When so the normal bleeding, that I then 3 or 4 pads a day.
Yeah, 3 or 4, and it does not, night we don't change, ma'am. So it's like, that's normal.
So
when 3 becomes 6 or more.
15 to 20 ml?
30, yeah, 15 to 20 ml, yes. And when we start changing the pads and we realize the first cycle, we may not pay as much attention. The second cycle, third cycle, we begin to realize that we are bleeding more than what we have bled till now. And when there's a change in the bleeding, when there is a secondary onset of dysmenorrhea, like when we had our periods at 12 years, 14 years, nothing was there. Now we started developing dysmenorrhea. We are experiencing drop in iron levels, weakness. Then we know there is a diagnosis in hand that we will have to find out and treat. So these are the conditions that we will look at. So what are the causes? The causes can be hormonal imbalances like PCOS, obesity, hypothyroid, fibroids, polyps, adenomyosis, contraceptive devices if they have been displaced or creating difficulties, pregnancy complications like could be retained placentas, which post-abortions, threatened abortions. There is an unusual case which I will share, ma'am. Born Willebrand disease is an inherited genetic condition that causes heavy bleeding. I'll discuss about it. And other medical conditions. Some of them we will take, some of them will be in combination. So I will start with the case 1, which is adenomyosis. Now, adenomyosis, I've been seeing a lot more cases in the last 4 to 5 years. Probably it wasn't so much, so many diagnoses of adenomyosis were not coming early, as much as what we have seen in the last 5 to 10 years, 5 to 6 years. So let's first understand that let's start with the case. The patient had a normal cycle and then suddenly she started experiencing once in 21 days, lasting for 4 days, severe pain and severe bleeding. And the bleeding was so severe that every 2 hours she was changing, not able to go to her work. She was a teacher in the school. And after 2 or 3 cycles, she went to the gynec, and the gynec's investigations on the scan showed the adenomyosis. And they said the only way to stop it is by giving injections. 3-4 months do not have your periods, and then again it will come. So that is how every 3 to 4 months her periods would come. And every time it comes, there will be severe pain. That is because of the pathology that is taking place. So this was her scan report, which showed myometrial suggestive of adenomyosis. So how do we understand this pathology? Surprisingly, we think that autoimmune conditions are joint related and other diseases in the body. Adenomyosis is also one such aberrant immune response of our body, where this endometrial layer actually starts losing its control and penetrates into the myometrium. Normally, that does not happen. There is a control factor that prevents the basal layer of the endometrium from moving into the myometrium. What happens when the endometrium now loses that control and you find these patches of endometrium inside the myometrium? So every time there is a period that is going to happen, there's going to be a internal bleeding inside the uterine myometrium layer, which is going to be extremely painful. And on top of that, the endometrial proliferation also is much higher. So it's going to bleed also, and it's going to pain also. So it's a very difficult condition to have. So the invasive basal layer of the endometrium is what is causing this. It means that we have lost control. So you can imagine if you're going to lose control of a very inherent natural pathway in our body, it means there is some underlying stress that you have built up, which is causing this aberrant immune response of the endometrium. So this is important just to know. And this is just a normal physiology. In adenomyosis, actually you don't find changes as much in the hormones. It is more of this estrogen stimulation sometimes going up and an inherent loss in the control pathway of the endometrium going into the myometrium. So the uterus will actually sense your endometrium in this growth as a foreign body, and it is all the time going to try and expel it. So these are the dots that show you how the endometrium is bleeding inside the myometrium of the uterus, and it's a very painful condition. So when there is dysmenorrhea with heavy bleeding, scan will give you the diagnosis, correct? And this is the structure I've explained to you. Since it's chronic, ongoing, you will find it more towards the psychotic, or sometimes even the tubercular miasm can come, depending on the personality evolving. So we'll understand this patient. Now, why did she suddenly develop this bleeding At the age of, she was around 38 when she came for this problem. And if you see, so she was a very hardworking, protected child of her parents, only child, born almost after 15 years of marriage. Mother was caring, father was caring. She was very happy in that environment. And she studied well, got a job in a bank, got married and came to Bangalore. Parents were in Chennai. How beautifully she set her setup was, her in-laws said that she should manage on her own with the children and work. So she decided to call her parents from Chennai to Bangalore, build a house where they stay down and she stays on top and they help her out with the children. So everything was pretty smooth and comfortable till the father fell sick at 87, age related. He developed myocardial infarct and he had some blocks. But post stent, what happened was the father is not used to a very perfect diet, exercise routine. She got very anxious. The mother also fell sick under the stress of this father's illness. That worried the patient more. As a result, what you find is suddenly over the years, she has now found that she is not having the kind of support from the parents. Her son, who's in the crucial 10th standard, is not listening to her. He's more used to his grandparents. And she's so worried that something will happen to her father, who's already 87 and not listening to her schedules of diet and all. She broke down with severe anxiety. Earlier, when there was an anxiety of finance, the parents sold the property and helped her to build here, that she was able to overcome. But this anxiety of health of family broke down her immune responses and she came down with adenomyosis. So this is the stress that we found and the pressure of son studies and the ill health of the parents for a person, an adult, who is so much into that protected environment. And the sickness of the parents makes her probably go back to a regress state of wanting the support all the time, even though she knows they're getting old. So what we will look at, these were the rubrics. This is just an overall understanding. Then these were the attributes: hardworking, stubborn, obedient, and I think the remedy shouldn't be a problem. In a stocky, chilly, craving sweets with this cutting, calcarea carb was considered as the constitutional remedy. What is important is it also covers the kind of bleeding. So most of the time, whenever we choose these constitutional remedies, it should also cover the patterns of the menstrual bleeding, whether it is late, delayed, normal, early, profuse, where are we locating it at? And at present, this is the structural pathology that is going on, adenomyosis. But the mind is very hypersensitive and there is a definite ongoing state of anxiety. So in such conditions where the sensitivity is high and there is pathology, we chose the millisimal potency. And this is something that was a take-home learning, because as soon as we started her on calcarea carb millisimal with a diet rich in estrogen, yoga and anxiety management, awareness of her psychosomatic illness that she's developing, and looking into the maintaining factors, especially the anxieties of her father and son. We continued the medicines until the bleeding stopped. So what happened? She responded to calcarea carb 0/1, then we made it to 0/2, and it continued for almost a year. I've not given all the follow-ups here, but within 3 months, the periods regularized and there was no pain, but we did not stop the stimulation of calcarea carb. Probably that was a mistake, because when the response comes, it's better to make it infrequent. The period started getting scanty. Then we realized we have overstimulated her and stopped the stimulation. The repeat scan did not show. I just made a note in the record book. I should have kept a and it did not, it showed whatever patterns were existing remained the same. There are no new patches of adenomyosis, and the patient did not have symptoms of adenomyosis. So finally, we stopped the treatment after a year with infrequent doses of calcarea carb, millisomyl 4. What was the take-home learning in this? One is we were able to stop the growth inhibition factor of the bacillus, whatever got reversed, we were able to bring it back. It was evident through the symptoms, the status quo of the patches of the adenomyosis, and no new further patches, no symptoms, and patient in a premenopausal state after not yet reached perimenopausal, and mental state was also getting better. So we found that over a period of time, the millisomyl potency has been found very helpful in such cases of adenomyosis with heavy bleeding. Because what happens is we need the stimulation until the point of response. And we find that we can do that with the millisomyl scale, which has both the high sensitivity and a local pathology going. So this was a very important learning over the next many cases of adenomyosis. This millisomyl potency with chronic remedies allows the aberrant immune responses to set right. So that was an important learning. And then we realized that we should use it a little more often to understand in which conditions of bleeding millisomyl works more and centesimal scale works more. We will come to know in the next case. So in this take home was this chronic remedy, millisomyl, frequent repetition till the point of response.
And before usually, you go to your next case, Lata, could you show us the working and why you chose calcarea carb little more? Go back.
Ma'am, this was the repertory table. Ailments from anxiety, aggravations before menses. There was irritability and tiredness, anxiety about health, future, finance, attachment to family, need support and security, obstinate, irritable, hardworking, chilly, sweating on head and underarms, craving for sweets, menses profuse, long-lasting, stocky and abdominal fat, fat more in a fair, short person.
What are the most characteristic here which took you to calcarea here?
So when we see this chart, ma'am, the manner in which she is adapting, hardworking, obedient, and wants the security and comfort of her family and home.
There is a question in the chat box. After how many periods the flow came down?
It came down like within 2 cycles.
So from every 2 hours, it became 3-4 hours very crazy.
It came from every 7 to 8 pads per day. It came back to what she used to use, 2 to 3 pads.
Very good. Very nice. Thank you.
Any other differentiation they want, ma'am?
No, thank you. Somebody is asking with millisomyl, do you give centesimal potency?
No. Once we start the scale on millisomyl, then you should rotate it in that particular scale itself. You cannot move from 0/2 to a 30 potency or a 200 potency. In fact, even if you're going to use an intercurrent, it is better to use it in the same scale as which you're using your constitutional remedy. So if you're going to use calcarea carb 0/2 and you want to introduce a tuja, then also you should use tuja in the millisomyl scale only. So do not jump potencies that won't be indicated. Ma'am, I can't hear you. Ma'am, you're on mute.
My dog started barking. Okay. So there is a relationship between a centesimal and a millisimal scale, you know. So sometimes you can, if you want to give single dose of intercurrent, you could give it if you use the same scale. So 200 is like 0/5, 6, you know. So there is a correspondence of centesimal and millisimal. So we
Yes.
use that. Thank you.
Right.
Thank you.
Is any other doubts there, ma'am, in the chat?
Nothing. Very clear. Very good case. Thank you.
Yeah, so this 1920 we started the treatment. By the time she got her periods on 10/11, the menses flow was normal. But then we had given every day 0/2. And then after 24/11, we started making it 3 doses and then 1 dose week.
Yeah.
Now we take simple cases of dysfunctional uterine bleeding that comes almost day in and day out to our clinic where there is no exact pathology. Now this during COVID, there were a lot of changes that happened to the lifestyle of a lot of people. So there was weight gain, not able to go to work, no exercises. And on top of that, there was severe work pressure because many companies did not actually pay full amounts that were due to them. So this was one such girl. She was at home. She started experiencing menorrhagia. She went to a gynec who told her this is because of the lifestyle changes that have happened due to lockdown. Don't take any medicines, try to modify your lifestyle and let's see after 4-5 months. Prior to this, she was having once in 28 days for 3 to 5 days. She was fairly comfortable. She didn't have any problems. So suddenly, the menses became profuse, long-lasting, and it very important. These characteristics are bright red, dark red, every time a remedy changes. And there was slightest movement would cause bleeding. So she literally had to take off for those 4 days. She couldn't even sit and move around. So either she'll sit or she'll sleep in this. Any movement would aggravate. There was a constant anxiety about her future and a very sad state of being locked up in the house. And there was pains extending from the back to the front. Anybody would like to guess the remedy? Ma'am, any remedies have come in the chat box?
Sabina.
Yeah, Sabina was chosen.
Sabina. Yeah, Sabina, 2 people have said, Rama, Aparna, Kaushal has said Rania because slightest movement, right?
So what happens is when there is no pathology and there are clear-cut characteristics of the periods and modalities, are wonderful remedies if we choose. And what happens is we don't realize that they also cover the mental state. So it was a retrospective learning of these were the rubrics that were taken: profuse, menses premature, menses late, menses bright red, containing the cloth, slightest motion aggravates, night also aggravates, anxiety about the future and sadness. And surprisingly, Sabina also covers the mental state. So it's not just covering the menses, it's also covering a mental state. That's when we learn to read, ma'am, because we have started reading these remedies only because of your classes a little more in depth. So what is it that is so characteristic in an LSMC? Then why not use it as a deeper remedy? And a little more, maybe it could be a chronic remedy. So this is, Sabina is usually used to induce abortions. It's an irritant and anti-inflammatory, very close to Tuja in its tendencies for arthritis and miscarriages. And in the mental state, they write that there is a tendency to sadness, melancholy, and a deep-seated anxiety about the future, very much similar to what our patient has. Now we'll go to some other remedies which cover in dysfunctional uterine bleeding, because I think everyone wants to know how we will use these other remedies also. especially thalassemia. There are a lot of questions that come, how do I use thalassemia mother tincture? So, but for that, let me just tell you that the best way to go about this is go through the LSMC and see if there is a mental state evolving, which also covers by that remedy. Stick to that remedy. Don't worry and don't mix up and don't use mother tinctures without understanding the totality. So in Hamamelis, it's a very passive flow of bleeding. However, there are pains in the ovarian regions. And there is an intermenstrual flow which is also present. And Hamamelis' mental state is, they want that respect. They want that lack of self-respect. That is a key characteristic of its mental state. And CKL core, a fungus, continuous bleeding. It does not stop from one period to another period. And dark red blood. If you see belladonna and CKL core are dark. And Hamamelis, millefolium, trillium, these are brighter remedies, like bright red blood. And in CKL core, you have an offensiveness of the mind and the body with a hysterical state and the anger and destructiveness of what a fungus represents. And millefolium is early menses. Millefolium is also quite irritable like CK, not the passive aggression of Hamamelis. And trillium and Sabina are very close in terms of slightest movement. However, trillium, Sabina is sad and anxious. Trillium is very excitable, irritable, and sad. And now that most important remedy, thalassemia, because a lot of people would like to use it in mother tinctures. It is useful in fibroids and in any inflammatory processes of the uterus. However, I still feel it's nice if we can understand this remedy in a little more depth and then use it as a mother tincture. Or if you want to use it as a mother tincture, be sure that when the bleeding stops, you go back, define the case, and put the patient on a chronic remedy. Very often, the characteristic presentation of the bleeding, the modalities, and the accompaniments will point towards the remedy, and symptoms are often the best guide for presentation in cases of dysfunctional uterine bleeding. And these bleedings will respond to the centesimal scale. You don't need to use frequent repetition. 1 or 2 doses and the bleeding actually will respond. 200, 1M, 10M also you can go to. But these kind of bleedings are functional and they will respond to the centesimal scale. Is there any doubt on this?
No, I'd like to share. Can I?
Yes, ma'am, share.
So you spoke about Hamamelis and you gave a very important rubric, which is respect desires. So I recently had a case of Hamamelis, and this is a boy, about 30 years old. He's not doing anything. The personality disorder case where he's not working. He's an engineer, but he's not doing. He stays in the room and says, "I'm doing some work." And he doesn't mix with people nor anything. So when I was talking to him, he always wanted to live alone, and he finally we were talking and I advised the mother, okay, let him live alone for a little time, because he's not a destructive or any other, except that he doesn't do work and he doesn't earn money. He is not doing anything harmful or drugs or any other thing. So let us see how he manages. So they left him alone for month and a half. And when she came back to the house from Dubai, mother stays in Dubai. So when she came back, the house was not swept and, a little bit of a mess and all. So when I was talking to him, I was telling him, you managed well, but you've been eating a little bit. And I was counseling him, talking to him and all that. And then I just said that, somebody may look at it and say that it is like a, not pigsty, the house. He got so offended, so wild. And he said, I don't want your medicine. I don't want to talk to you. I said, I don't like to talk to people because they don't respect me. I'm an engineer. So, and people don't talk to me nicely and they don't respect me. And that was really, and then I have to talk to him saying, I've just used the phrase. I'm not saying the house is like that or you're like that. I've just used a phrase. Somebody may say it is like that. So I didn't mean to hurt you. And I had to a lot of talking before he calmed down. And I gave him Hemamelis on this, basically this whole picture. Sometime I'll share this case with you, but that is the main thing, was that his respect is not being, adhered to by people, and so he doesn't talk to anybody. And today the mother reported after 3 weeks that he is a little bit better. He's behaving better. He's listening. He's responding to me. Yeah. So I wanted to share this very new experience for me. So I wanted to.
We will keep in mind that lack of respect and hammer malice too.
Yeah. And you brought it out so nicely. So I wanted to share. Thank you.
Thank you, ma'am. Any doubts on this dysfunctional uterine bleeding case?
Very nicely you've differentiated all the remedies, and it'll be very useful. Yeah.
Shall we go ahead, ma'am?
Yes, thank you.
Shall we go ahead?
Yes.
Yeah. So this is a very different case. It's one Willebrand factor deficiency causing severe bleeding in a girl who was just about 13 years. The father had written and come that please help her with the skin. I do not think you can help me with the genetic disease. So do not bother about it. Just give me medicine for the skin. And the best part is, ma'am, when we took this patient inside, this 13-year-old girl, all that she shared was, doctor, I don't want further skin. Please cure my bleeding disorder. And so it was like, oh God, what do we do now? That father so clearly told us that we can't touch this genetic disorder and you won't be able to do anything. And this is the girl who's pleading to us. So it was like, let's take the case and let's take a chance. How are we going to treat this? So last 4 months, she has not gone to school because she bled so heavily in the class. She had to go to change the pad every period and the teacher got angry. And she became when somebody shouts, some of us will feel humiliated. Some of us will feel what the children will think about us. What is this? Or feel that, so why has God given me this illness? What this girl went through was extreme anxiety. Oh my God, what will happen? How will I go and change the pad? That is what was working in her mind. And then she told her mother, until you cure me of this illness, I'm not going to school. I'm going to stay at home. And the parents were, she was one precious child and they didn't want to trouble her. So they said, okay, stay at home. We will homeschool you. So suddenly when she got, that is what happens in this von Willebrand factor deficiency. Either it might happen, you get an injury, or the first time you notice it is when you have a dental attraction or you get your periods for the first time. So the first time it was slightly uneventful. They didn't pay attention to it so much. However, the second cycle, she started bleeding from October for 25 days. She was given a pause thrice a day. Finally, after thrice a day to a pause, it stopped after 25 days of pause treatment. Then they had to give her injections to stop the periods. Again, after 3 months, she will use pause for 25 days because her blood does not clot. That was the problem. Now, what is this disease that we are treating? So when you first hear, don't get in there. There's nothing to be intimidated. It's a deficiency. There is a protein, von Willebrand factor, that is secreted by the platelets and usually on the surface. And this is the first factor that is required to initiate the clotting process by binding all these platelets together to form a clump. Then your clotting mechanism will start. And then you will be able to build those fibrins and organize the clot formations, and then the bleeding will start. So this is one of the most initial steps before the clotting mechanism, and it is found in the platelets. And it is described after the doctor who sends it. Von Willebrand factors are usually glycoproteins. They bind to other proteins. They mediate adhesion of the platelets, and that will help you to initiate the clotting factor. Now, in this case, it was classified as type 1, where there is quantitative decrease in this. It's not completely absent. A complete absence is type 2 with a very poor prognosis. A type 1 is just qualitative decrease and a quantitative decrease in this factor. What will happen if this factor doesn't get secreted by the platelets? The universal energy has also made a possibility of secreting this from the endothelium of the blood vessels. So if your factor is deficient in the platelets, you can recover if you are able to secrete this from the endothelium. But what is it that prevented this from happening in our patient susceptibility is unique for the homeopathic system. So when we try to understand, because it was coming across, did the anxiety cause this inability of the system to stabilize? Or did which is first? Which is the hen? Which is first? The hen or the egg? Is the anxiety causing this, or this is causing the anxiety? And both are creating trouble for each other. So let's understand this patient. First, you should know what is the test that needs to be done, the bleeding time, thrombo. I will show you in the end the comparison before treatment and after treatment of these levels. Let's try to understand this child. Mother could not conceive for 8 years, and then after 8 years when this child was conceived, it was an extremely caring and sensitive and anxious, protective father, and the mother who was slightly strict with her. So the best part is the father comes to the clinic with the child and the mother is sitting aloof in the waiting room. The father comes running inside and tries to explain. He's so fond of that daughter and he does not want her to suffer. And then, but the mother is little bit strict on many things. She wants her to study, she wants her to dance, she wants her to go for painting class. So she's a very average in studies, but the mother doesn't push her to come first. And then she wants new things, but they usually pamper her and give it to her. When she attained MENA, there was one event, grandfather died, but she overcame it. The whole problem initiated when the bleeding increased and the pause came into play. And she was suffering from severe gastritis because of the pause. The characteristic mental symptoms that got evolved was anxiety, 3 marks, anxiety about health, a state of fear, sleeplessness, irritability with pain of this gastric, and why I am not getting relief. And what was important, ma'am, was this child was so pretty that you could actually see on the white skin the veins that are there. That much is the clarity of her skin. And petite, fair, and long eyelashes. And we were thinking of phosphorus because she was so pretty. And only thing that was she was shy in the initial with us. She took time to open to us. She waited for the father to go out and very softly and put her head down and asked, "Can you please help me with this bleeding?" Like it wasn't like that hope of phosphorus telling us that there's nothing wrong with me, but I know you can help me, please help me. And that connectedness, this was more shy, so anxious, and you could feel that she was so comfortable sitting at home. And then we were feeling so bad, an 8th standard girl sitting at home, not able to go to play, not able to meet her friends. I said, don't you miss all that? She said, no, as long as I don't I don't have to change my pads, I'm okay. I said, why don't you go in between when you don't have the periods? She says, no, I don't want to go. She's just developed an aversion to the school now. Very important characteristic rubric, aversion to school. There are only 2-3 remedies. And one of them is calcarea phos. So calcarea phos has this feeling that it's very comfortable to be in its home and has this aversion to going to school, which made us think of this. It also covered this bleeding tendency and also this kind of home setup. And then these were the rubrics that were taken. Anxiety ailments from menarche is also covered by calcarea phos. The onset, it's very important because von Willebrand factor disease can express in some patients in dental treatments, falls. In our patient, it expressed at the time of menarche. That's why we've taken ailments from menarche as a key characteristic. An aversion to school with a sad, melancholic state, and aversion to mental exertion, doesn't want to write any exams. So the teachers are also not putting any pressure on her. And these were the remedies that came up. Calcarea pulsatilla, calcarea phos, lyco, and phosphorus were the first 5 remedies. And as I told you, that aversion to school and that ailments from menarche and a child who was very comfortable staying at home made us think of calcarea phos in a tubercular patient. And so it's important to note that generally bleeding disorders have the psychosomatic underlying evolution of some conflicts with the parental, especially the maternal figure, which probably also makes an impact on the kind of role playing that they carry forward. However, that is just a very broad understanding. And then we come back to case specific to actually understand the impact of that on our patient. So what happened in our patient was the mother, even though is little strict, she could manipulate her way out and tell the mother that I don't want to go to school and I'm not going to all those classes that you're telling me to also. So it was like she was able to find her way out. So not some with her very sweet, nice talking, she'll be able to find her way out. So that's also important how they adapt to these. Otherwise, some of them will brood, some of them will get angry with the mother, some of them will resent the mother for life. Our patient could find a way out to convince the mother that she neither wants to go to school nor to the classes the mother was. So with this kind of a totality, we first thought that we should reduce her bleeding and whether if our remedy is right. And then if this is what we have undertaken as a reading, that it is possible for this factor to get secreted by other sources like the endothelium, then our constitutional remedy will reorganize the hemodynamic equilibrium and set right the susceptibility. Considering the structural changes and the high sensitivity, again, it called for a millisimal infrequent repetition. So the response was immediate on 2011 when she got her first period after giving calcarea phos 14 doses. The period stopped first time after 3 days and she was on a normal flow and she did not take phos. And it was also because that we had given her some hope and that also worked on her anxiety. That's when I said, was this the hen and egg, which is coming out first? So when the anxiety settles, the chronic remedy works, the hemodynamic equilibrium that sets in is almost immediate. And then we continued calcarea phos, and she was continued on this treatment for the next 1 year. And we kept her on calcarea phos 0/2 and then 3 infrequent doses. She finally went to school in January after 3 months. And then when she realized that the 2 cycles of hers have settled, she went back to school. And then there was no problem because that was one factor that was very important for us, is not to keep her at home. And then she continued her routine. So this is the, why we chose milliciment, I've explained to you. And these are the readings, ma'am. This is before treatment. The hemoglobin was 10. After 8 months of treatment, 12.1. This is the bleeding time. This has improved. Clotting time, you can see prothrombin time. And there was one factor. This is very important. The activated PTT is 28 and 43. Normal is 21 to 35. So when this activated PTT comes, it means that the body has started secreting this factor from the endothelium. So this was what showed us that the improvement is there, and how much ever factor, in her case, the factor, there is one more, that particular factor secretion, von Willebrand factor secretion, it was marginal. Normal is 28 to 34. Hers was in the range of 28, but it was enough for her to see that the menstrual bleeding stops. So even though it's a genetically inherited disease, but it's a mild type 1 and the body will stabilize. Core conflicts, role identifications help us to find the right remedy that covers predisposition to disposition to expression. And once again, millismal scales get indicated when the sensitivity is high and there are structural alterations.
So in the chat, we had one person, Dr. Joe, who said calcarea phos. Dr. I think Dr. Nisha. Good, Dr.
Good,
Nisha.
good.
Yeah. Yes, ma'am. Wonderful. So you're showing completely how, what is called, that it is a case which will be accepted by anybody in the world, because you have proof in, what we are doing and how the homeopathic remedy can normalize whatever factors are
deficient.
Evidence-based treatment. Thank you.
Any other questions, ma'am? Shall we go ahead?
Go ahead, please.
Yeah. So this is another condition that we frequently encounter is uterine polyps and PCOS. Often we are asked, should we leave the polyps alone because they are precancerous? Should we treat or shouldn't we treat? So in our experience, when the patient is in the younger age group, 35 to 42, the gynecologists usually tend to wait if the polyps are not growing and if the periods are regularized. They tend to wait before going in for a surgical removal. And if they reach towards menopause and if the polyps are creating difficulties of excess bleeding, then only after 6 months of treatment, the gynecologist decides to either remove the uterus or only remove the polyp. So as homeopath, we can take the judgment based on our assessment of susceptibility. So this is the case of a lady. Can you see she has a hemorrhagic cyst. She has a endometrial polyp and an adenomyotic uterus. So what is unique about this lady? So she is 42. She's not yet in menopause. She's bleeding, but she's bleeding very heavily with severe pains. And what got this sudden bleeding and with so many changes which happened in a matter of 1 year? If you can see the location, there is a left side hemorrhagic cyst and there is a endometrial polyp. So what happened? Prior to the onset of this disease, 1 year before, the husband goes on a trip to the US and she believes that he had an affair with her brother's wife, that is her co-sister, and she saw some chats between them when he came back, and she was 100% convinced that he's got an affair with her. So it was a little odd for us because this is a marriage of so long, that many days she didn't have all this doubt on him. And suddenly she, with one event that he goes to the States and some conversations between them, she has decided that he is not right for her. And there was such an intense reaction and a sudden cutoff. And she said, the very interesting part was she comes out of the house of the husband, fights with the in-laws, mother-in-law, that you better give me the house to stay and don't send this man there. And then she takes the house, she takes the FDs. She's not the silent rebel type, not the one who will keep inside and suffer. She takes all her rights and comes out. She didn't stop there. She fought with her mother also. How dare you think that I'm going to stay here alone? You better give me a property from your share also, and ensure that my child studies in the best college for IIT. The hatred against the mother was right from the time she felt that all the mother did was only pamper the brother. So, but the expressions were managing till this event happened. And then suddenly she got so angry with that husband. And I think the whole toll of this event and her pattern of expression just ensure that all my needs, my security is met, even though she's been so violent about it and so vocal about it, and actually fought with everybody. Finally, she got her way. She got the flat, she got the FD, she got money from her mother for the son's education, and she never allowed this man to come into the house again. And officially did not divorce him. The manipulation went to such an extent that until my son completes and I get a good alimony, I'm not going to just divorce him and leave him. So for everything, there was so much of clarity in her thinking of what she should do next. And then that's when we thought of lachesis. So initially we had given her phosphorus, thinking phosphorus is a very good remedy for polyp. But then we realized a constitutional chronic remedy, which will also work on these tendencies of hemorrhagic diathesis and a polyp and this kind of mental state. And you can see the latest report. I hope it's mentioned here, there is no evidence of a polyp and only an adenomyotic uterus. And there is no hemorrhagic cyst in the left ovary also. It's mentioned in that report. And this case, we did not go to millissimil. We just gave her in centesimal 200 weekly doses until her periods regularized, and waited and observed and repeated the scan after a year to see what has happened. And then when it was regularized, we stopped the med. We told her whenever you get into any difficulty, you can come back. So it is important to have a gynecologist opinion in every case of polyps because it is a precancerous condition. It is important to ensure patient adheres to strict follow-ups. It's important to educate her also. We were very clear with her. Anytime your bleeding patterns change or increase, it's important you come back to us and you also show your gynec and repeat the scans. Chronic remedies that cover expressions of the mind-body miasm in centesimal or maybe even in millisimal scale will help. So Tuja, Calcarea, Phosphorus, Lachesis, Crotalis, all these remedies have been, snake remedies and these other remedies have shown good results in polyps. Any doubts and questions here?
No, very well explained. There's nothing in the chat also.
Then we will look at fibroids. So fibroids is again a very spectrum that we find where we realize that, at what age do you get diagnosed with a fibroid? So you get diagnosed at a 27, 28, we have to aggressively treat it. You could consider remedies like Oremure to reduce the size because this is a reproductive age group that we are dealing. Use more intercurrents because there is an underlying miasm that could have predisposed to you developing a fibroid. in this age group of 28-30. But fibroids that get diagnosed when you're in the perimenopausal or menopausal age time is usually due to the abnormal hormonal imbalances, and they are best treated with our medicines. And if the fibroids even slightly decrease in size and you attain menopause, just be happy about it. And cases that are in the middle age group, 35-40, again, we will have to use constitutions and intercurrents to see that we reduce the size of the fibroid, because we don't want them to bleed. They have another 10 years more to attain the menopause. So it really depends on which age group you're targeting. Accordingly, your management also will change. So you can have a very aggressive management with mother tinctures and intercurrents in this 28-30. You could look at chronic and intercurrents in 35, as well as in menopausal age group. Do not overstimulate. Give only as much as required to stabilize the hormones. Reduce the periods. Even if the fibroids don't dissolve, don't worry about it. Ensure that you educate the patient. If they bleed after 6 months or a year, immediately get in touch with your gynecologist. A scan every year will also ensure that your endometrial thickness is carefully monitored and you don't get into any precancerous stage. So this is the case of a menopausal, premenopausal age group of a patient, 44 years. She's the CEO of a software company. Heavy bleeding in the last 6 months, and she was advised hysterectomy. It's very important in PCOS and in fibroids to do the FSH, LH, estrogen, and progesterone to know in which category they belong. So here the FSH and LH are almost touching the menopausal age group, and so is the estrogen and progesterone. So you know that she is going to be maintained and within a year or two develop menopause. So we have to think and do our management carefully. What was the stress for the CEO? She was having severe financial strains because the company was not able to get enough projects. And coupled with it, there were changes in her body. She was not able to find motivation to go for her workouts. Otherwise, who was so ambitious, hardworking. The financial anxiety made her drain her energies, and coupled with the premenopausal state, she started gaining weight, and it worked like one: obesity, aggravating the hormone change, aggravating the periods. Because of the manner in which she had evolved and the focus, she was all the time talking to us about her financial implications and how much the company has to make profit. We thought of calcarea floor because she really was. The other remedy was sepia that was coming up, whether this is a hardworking, ambitious sepia, but we found this lady was not indifferent at all to her surrounding. She was hands-on mother even now and finding admissions for universities abroad, taking care of the employees, loving her travels and going there, and generally all over the place in society, family and work. That's why we ruled out sepia and we gave her calcarea floor, weekly doses, got her back onto her exercises with awareness of her phase of life, an awareness that how much anxiety the body can cope with now. She's not a 20-year-old CEO. She has to understand and let go and decide how much she wants to take on the stress. And this was the report. So the report showed after 1 year, the bulky uterus was same as compared to the prior examination dated on 17/10/2020, where we started the treatment, and the scan is done on 12/6/2021. The size of the fibroid remains unchanged, and the bleeding disorder does not recur, and patient has been symptom-free. So that's how we managed this fibroid. We didn't overstimulate her. We didn't have to use too many doses of puja. We just kept her only till the bleeding stabilized. The top remedies we have used for fibroid, sepia, calcarea flow, calcarea carb, phosphorus tuja. However, the range is much more, as ma'am is teaching us so many kingdoms. I don't think you should stick to only this. And it is difficult to conceptualize mother tincture, but I would suggest if it is a very young patient and we really have to aggressively treat, do think of Aurum metronatum. Interestingly, Aurum metronatum is a very nice drug that can be studied as a deep acting remedy also, because it has the values, conscience, and the responsibility of an aurum, and a natrum, sadness, disappointment, grieving. So do think of it as a chronic also, or you can also use it in a mother tincture. If there's a threatening fibroid and there is no way we are able to get it removed, do consider it in mother tincture, frequent doses. This is the only remedy that I know, but I am sure my sirs know many more remedies in mother tinctures. I'm sure we can have a session on mother tinctures to expand our knowledge on this. And Tuja is also a wonderful remedy as an intercurrent in this kind of threatening large fibroids. Otherwise, constitutional, centesimal, infrequent should do the work in perimenopausally. Within a year or two, they will reach. If there is no anemia, no other complaints, I think you can stop the remedy. Is there any doubts on this, ma'am? Fibroids?
I think you've been very clear. There are no questions. And somebody said it's been given exactly as per strategy. So that is good. They all accepted all the remedies used. And I think very systematically you have shown improvement in all the 5 cases. And you have shown that you have to monitor, counsel, and see that the patient keeps all right. Most important, you have brought out in fibroid that even if it stays, as long as it will become smaller and that it doesn't, the bleeding is controlled, then it is very, very all right to let the fibroid be there. So very clear is the comments, very clear, and lot of learning at the comments in the chat box, which is very good, and a lot of hints to take home. Thank you so much.
Thank you, ma'am. So I think I was given 1 hour to complete this, ma'am. So,
so you were exactly on time. So yeah, very good. So we're very happy that our 39th webinar has gone so well with a group which really understand, really interested in learning. And we have this group with us all the time. We're very happy that NJH can, promote this kind of learning. Yeah. And we know that all the other activities of NJH are always on. The issue comes out every month on the dot. It is posted on the 18th and it reaches you by somewhere in the 21st, 22nd, whatever, depending on where you're placed. If you don't get any issue, please complain then. We often have people telling us, I haven't got the issue for 3 months. We are posting every issue. If it's not reached, there is some problem with the post office. Contact us and tell us. We cannot know that you have not received. And don't tell us 1 year later because we won't have the issue to send you. We'll always share another issue if the complaint is genuine, but you must check with your post office also because the issues are very attractive. Sometimes they take it away for their doctors. So you must always check with your own post office. So that is about NJH and all its activities. We have once a month the webinar, once a month the 4th, we have the round table, we have the Tuesdays, we have the Telegram case discussion, we have the CME. So there is something, and we have Saturday newsletters, and we have the YouTube channel, which everybody can look at. And thank you everybody for being there, and thank you for learning, sharing with us. And thank you, NJH team, is what the comments say. Thank you. Thank you, Lata, for wonderful, systematic, completely clear, no doubt presentation. Very, very nice. Thank you.
Thank you, ma'am.
Thank you so much. Yeah. So we'll call it a day today, and we will meet in 5 minutes. Thank you all.
We should leave and join back, ma'am.
Yes, it can send us.